Dr. David Green van Medclaim Assist, like now by my hello David.
Hi.
David, Medclaim Assist, what is it that you guys do?
So very simply, we help people get their medical aid claims properly paid. So when a claim is short paid or not paid, we evaluate it, and if we can help, we help people get them paid.
But surely, from a medical aid perspective, there's a lot of claims that should really not be paid. And as a percentage, what claims shouldn't just be paid?
So yeah, I'm not sure of the percentage, but I mean, obviously, if there's no benefit or it's a plastic surgery case or something like that, then obviously the scheme isn't liable. But there's a whole group of cases around prescribed minimum benefits, PMBs, where the schemes are required to pay. Under certain circumstances, they don't have to pay in full, but they should be paying, and often mistakes are made. And they're not paid.
So at the moment, most of the headlines are talking about how expensive healthcare is becoming in the industry, or in South Africa specifically. And the reasons given is faulty claims from both sides of the coin, from patients and doctors. Is that really the case?
Yeah, so the reason why healthcare is very expensive is complex. People are getting sicker and older, and there's increased use of technology and better technology available, which is more expensive, and more expensive medicines and so on. But yeah, there are problems of a proportion of people exploiting their medical aid and proportions of doctors exploiting problems there as well.
Do we understand the extent of it?
I'm not sure. The Board of Healthcare Funders last week estimated that there's about 22 billion rand of fraudulent claims in the private sector, which strikes me as quite high. If you asked other groups to estimate, it might be lower. I mean, the industry is about 170 billion rand, so 22 of 170 sounds high to me.
Another thing in the papers at the moment is, of course, the National Health Insurance Act, and we saw the white paper that just came through from the minister. Do you think that we could implement NHI in South Africa?
Tough question. I think that the way it's formulated at the moment, no. So I think I have serious qualms, difficulties with the single payer. And the arguments in favour of a single payer is negotiating better prices in the market. But in the same time, the white paper talks about the government setting prices, so they wouldn't need to negotiate, they'd be set. And putting a pool of several hundreds of billions of rands into one place as a parastatal worries me. And I think that there are more efficient and better ways doing it, and of doing it. And I'm pleased to see that one of the work streams that has been set up is including and engaging with the private sector.
And that's what I wanted to talk to you about. Is this public and private sector collaboration? Because we built these beautiful private healthcare facilities in South Africa, and we actually export that service to the rest of the world. But yet our state system is failing. Isn't this an ideal opportunity to actually introduce people to private healthcare?
Well, I think so, yes. I think that there are massive inefficiencies in private healthcare. Just to give you one example, is the best and most efficient and best quality service you're going to get to have a baby is have a midwife deliver it, not a super specialist obstetrician and gynecologist. And so, yeah, I think the private sector has a lot to offer, but it needs to drive greater efficiencies to be able to serve a far broader group of people than it is at the moment.
So I have to ask you the question, if you were on the panel advising the minister on the NHI, and say, for example, we had the money to implement this, what would be the most ideal way for us to start this implementation process?
Tough question, So, I would think that identification of a set of basic primary healthcare services, vaccinations, midwife services for the delivery of a child, and GP services and so on, as a basic package which can be bought by multiple purchasers who compete against each other on efficiency in buying those services would be the way to start.
I said I am going to ask you the question because my mother asks me every time, do you have gap cover? And I'd like to ask you, should everybody have gap cover, and is it actually worthwhile?
Yeah, I think gap cover is pretty important. So if a doctor was just to charge what a medical scheme pays, they would struggle to make ends meet. And I have friends who are doctors who charge what medical schemes pay, and they struggle to make ends meet. So they need to charge more than medical aids pay. And if you don't have gap cover and have an expensive operation, then you might find yourself short of quite a significant amount of money.
David, thank you so much.